All right, HC Eagles, I would like to thank you all today for joining the Office of Student Life for one of our breast cancer awareness events for this month of October. I would like to introduce to you our keynote and guest speaker today is Ms. Cheryl Reese. She is surviving and thriving, living with breast cancer. She's come to share her journey, her thoughts, and then also just some tips on staying, I guess, cognizant about your health, young ladies, in regards to breast cancer. So I would like to send it over to Ms. Reese. Thank you so much for being here today.
Thank you for having me. I really appreciate it, and I love to talk to everyone about my experience, and hopefully you won't have the same type of experience. So a little bit about myself. I am a 39-year-old woman living with metastatic breast cancer, also known as stage 4 breast cancer. So originally, my first diagnosis came at an early stage, you would call stage 0. I was 26 years old, single mother of one, in graduate school and working full time. So uh, I ended a long-term relationship, and I decided I wanted to do something special for myself. And I had always um, not suffered, but I had larger breasts. I was a small young lady, like 100 pounds, with size triple D breast. And so I decided I wanted to get a breast reduction. I'm a very active person, and so it just was kind of hard dealing with those, with larger breasts. Um, I got it done the Tuesday prior to Thanksgiving in 2007. And so after the surgery, it went well. However, the surgeon was concerned with the amount of drainage that was coming from my left breast. But in the background, he never really told me the reason why he had a concern. So I just thought it was just part of maybe preventative care or post recovery care. So the Friday after Thanksgiving, the doctor's office opens to kind of like follow up with my reduction. And so they made it a point to have me be the last patient. Even though I got there pretty early, I sat there and watched patients come in and out. And I just was very concerned about why it took so long. And I just thought it was just poor care. So finally, I was the last person there. At this point, the time had changed, so it was dark, and they asked me, did I have anybody there with me for this appointment? And I was like, no, just a follow up. I'm fine. I'm used to doing things by myself. And they let me know that they checked my breast and the tissue that came out from the surgery and sent it to 7 labs. And all the labs came with the same conclusion that I had early stage DCIS, which means that that is a breast cancer that is in the milk ducts. It affects that. It's the most common type of breast cancer. So they sent me over a referral to the MD Anderson, and for me being 26 years old and a single mother and not a lot of um, knowledge of breast cancer. I am an adopted child. My cousin adopted me when I was quite young. So I didn't know my paternal side of my family as well as I knew of my mother. However, I didn't know the our genetic or our risks that we may have. So that was one of the things that breast cancer just never came up in our family. We had heart disease and a lot of different other things, but that just was like a shocker. Uh, and when they gave me the news, my first reaction was not that I'm going to die, that I'm going to have to go through chemotherapy or any, those things. It was just kind of like, what do I do next? How can we get, on this right away? So they set me up, with the best team of doctors for young women. Uh, and so we, decided that we're going to remove the left breast. Um, and all my appointments I went to by myself. I didn't have a big tribe that was there to support me. So it kind of had me to where I'm 26. All I'm thinking about is I'm not married, I'm single, and things like that. So they gave me the option of removing one of the breasts. And the reason for the decision that they wanted to remove the breast is because the disease had completely taken over every one of my milk ducts. The great news was that it hadn't left it hadn't broken through, it hadn't gotten into the other local tissues or things like that. So we caught it quite early. So after the mastectomy, we also did radiation treatment because my margins were so large that, so much of an infected area. They wanted to make sure that I was completely protected against, disease, that it wouldn't come back, because at 26, this is more likely a disease that would happen to an older woman. So, I have a lot of life left in me, and so they wanted to ensure that, things were okay. So we went through the treatment. Everything came out well. Um, it was a very, very humbling experience. I was always known as the girl who had the nice breasts, just known for like just being very athletic and, loving my body and things like that. And so I had to completely see a new type of body. It just almost felt like I was like Frankenstein. One day I have these nice breasts, then I get a surgery to have even nicer breasts, and now I have none. I just have, reconstruction, which they did what they call a free flap. They removed tissue, muscle, as well as fat from my stomach and placed it into my breast the same day that I had the breast removed. So on the outside, it just looks like a regular breast. It looks just like, yours and mine, everybody else's. But underneath, I have to look at a lot of scarring. I have to look at my stomach is being completely cut open from one side to the next, as well as my breast. And so me being a person who loved to wear bikinis and things like that, it changed. It definitely changed. It made me more self-conscious in myself. It also made me to where I didn't want anyone to see me in this way. But of course, being 26, you still want to date. You still want to find love and things like that. So, those are the things that you kind of fight through when you're younger, dealing with breast cancer. Not just younger, but just in general. But imagine a 26-year-old with this. So, as I was saying, the treatments was more of like removal of the breast, as well as radiation. Another option that they gave me was that I could do a medication called tamoxifen. Now, tamoxifen can cause, will stop you from being able to have babies and things like that. Or if you are pregnant, get pregnant, it would cause deformities in those babies. And I knew at my age, I still wanted to have more children. I only had one at this time and never been married or anything like that. So we decided what we're going to do was take an approach, and the tamoxifen was going to help me from getting a breast cancer within the right breast, because mine was only in the left. And so we decided we're going to not do the tamoxifen. We're going to just kind of like look at my breast every year, do mammograms and do ultrasounds. So every 6 months, I would do either a mammogram or an ultrasound, and everything looked good. I was staying active. I finally, after a couple of years, started to get a new leash on life. Um, I really didn't talk about breast cancer much that first time around because they said I had stage 0, no big deal. That's not even a real cancer. And so that's what was always in my mind, that it's not a real cancer. So I don't really have to worry like everyone else does. Now, had I had more support and gone into these support groups, I would have known that there's a 30% chance that you will get another breast cancer. And the more years you're alive, the larger that, chance is. So we fast forward 10 years later. I'm so excited. I'm getting ready to celebrate my 10-year cancer anniversary, being cancer free. I bought a brand new home, and I was doing a little bit of home repairs. As I was reaching for the shower head and trying to change it out, I spilled a whole bunch of like bodies stuff on me, and so I had to wipe it up. And as I'm wiping it, I noticed under the arm that I had the reconstruction and the mastectomy, that I had a marble-sized growth under my arm, which was odd because I had just had a pap smear 2 months prior, and she did the examination, and there was nothing there. Now, I never dealt with having a lump or having any type of growth and trying to figure out what it should feel like. But being that I had reconstruction, a lot of times that tissue will die, that tissue will move around, and and things. So I just thought it was just part of that tissue. So I went to my primary care doctor because I wanted to make sure that it was just that. And so when she felt it, she said, yeah, it could be scar tissue from your reconstruction, but having a history of breast cancer, I would, like for you to go see an oncologist. And so I said, okay. Now, this was during the time of I guess, the storm back in 2017, the hurricane in Houston. So a lot of things were closed, and so the MD Anderson wasn't taking any patients at the time. However, strangely enough, they were able to get me in like the next week. They were like, okay, somebody canceled, so come on in. So that day I met with my cancer prevention doctor at the MD Anderson, and she was like, well, let's do an ultrasound of it. And during that ultrasound, I just noticed that the tech kept doing a lot of typing and clicking and clicking. And I'm asking her, I was like, is everything okay? Is the scar tissue is worse than I thought? And so she said, this is not scar tissue. And usually, the ultrasound people, they're pretty quiet about things. So she called in a team of doctors in there, and so they all looked and they said, we want to biopsy this growth. And so I was like, okay. And so we did the biopsy, and this was the worst experience of my life. I'm there alone. Um, all of a sudden, we're going to have like a surgery, and all of a sudden, my local anesthesia goes out, and they have to continue. So I'm there screaming as they're scraping this mass, and so I went back to my oncologist and the same day and kind of talked to her and said, hey, so what's going on? What are we going to do? Why are they thinking that it's more than just, a growth? So she did give me a picture of it. And what she showed me was that there was blood and oxygen going through that mass. Now, if you know that a regular mass would not have that, it would just be dark. There would not be any type of oxygen, so that there was some type of life in it. So I waited for like 3 days for the results. And so I'm at work, and they said they would give me a call, and I waited for that call. I just did not leave my desk because I wanted that call, and I wanted to make sure that it wasn't my cell phone. I wanted a local, a number to where I didn't miss it. So the 1 second that I go to the restroom, that's when my oncologist calls. And so I missed her, and I'm like, oh, I'm freaking out at this point. So I go on to the MD Anderson site and looked at my medical records. And guess what? They uploaded my medical records before I even talked to the doctor. And what they found was I saw that carcinoma. And I'm like, invasive carcinoma. And I'm like, what's going on? And so I was freaking out, kept calling the doctor. She kept going into into patients' rooms. And I was just so scared. So finally, we got in touch with each other like 5 hours later. And she did say that it is your cancer has returned. And you have to understand how I felt. I wasn't scared that I was going to die. I wasn't scared of anything. All I was thinking was, am I going to have to go through this treatment again? Am I going to lose my hair? Am I going to do all these things? Am I going to have to go through another surgery? So we set up, the same team that I had the first time. The scary thing about this was my plastic surgeon, Dr. Bain, one of the best plastic surgeons out there. She had gotten breast cancer right after me diagnosed, and she died. And so she wasn't part of my reconstructive team and things like that. So that scared me, because if one of the best doctors who deals with breast cancer every day dies of breast cancer, it has you completely like mortified. So we decided that we're going to go ahead and be aggressive, because based upon the size of the tumor, we were looking at like a stage 2. So we wanted to set up time to get my port put in so that I can do my chemotherapy. After chemotherapy, we were going to remove the mass, because sometimes chemotherapy will shrink a tumor, so maybe you won't have to do so. But one thing that they noticed is that they went back to my medical records from 10 years prior, and they noticed that one of my sides, something looked a little bit different on the bone and the tissue, so they decided they wanted to do a full scan. They never told me why they were doing this. So they checked my bones, they checked my brain, my liver, and those are the main targeted places that breast cancer spreads. It spreads to the brain, the bones, the liver, and so those are the main things. They can go anywhere, but those are the main places. And so they found nodules in my lungs, as well as a spot on my liver. So we did a biopsy of the lungs, which was the easiest part for them to get to. And of course, it was breast cells. And I didn't understand what that meant, that I had breast cells. And they kept telling me the best case scenario was that I had lung cancer and breast cancer. And I'm like, why would that be a good idea? Why was that good? Not knowing that if it was breast cells, that my breast cancer had spread to a stage 4. And so that's what we found out. Exactly 10 years, October 27th, I was diagnosed with metastatic breast cancer with metastasis to the lungs as well as liver. And that was a scary moment. I had no idea what metastatic breast cancer was, even though I had an early stage breast cancer. And so all of a sudden, they stopped the surgery for me to have the port put in because they said there was no need for it. Now, I have what they call a hormone receptive breast cancer. So we're able to do hormone therapy and things like that to treat it. So we decided we're going to go with something pretty mild. And so we're going to go back to that tamoxifen that they had suggested I take 10 years prior as a treatment option for this metastatic breast cancer, as well as later on getting onto other medications. One thing that I had a concern about when going to the MD Anderson, best place in the world, of course, most people, as most people say, I felt that it wasn't that I didn't get the best care. I didn't ask the right questions because I didn't have support or I didn't have the knowledge or the wisdom at 26. Now I'm here at 36 years old. So and there's more internet access, more information out there for me. And so one thing I did notice is that, hey, estrogen feeds breast cancer. You guys want me to take medication to stop me from having a menstrual cycle, because a lot of the medications for treatment for metastatic or any type of chemo pill or thing like that, you have to be in menopause. And of course, I'm young, so I was not. So one of the options I had was to take a shot, which you would take, it would put you into menopause, but I didn't like adding extra medication to it. So I decided that I didn't want to do that. I decided I wanted to take a few months to decide what treatment I wanted. And I said, now that I have this metastatic disease, I'm in stage 4, there's, why are we rushing? So what I did was I decided I wanted to have care closer to myself. From my last diagnosis, I had moved to Austin, Texas. And so it was hard. I was going to Houston every 3 days, for 3 days out the week and coming back home. And I have at this point 2 children, a 15-year-old and a 5-year-old. So of course my 5-year-old then is now 15, and so it was almost like deja vu. Everything was happening again. So I transferred from the MD Anderson, and I started going to Texas Oncology with the Dr. Beth Hellerstedt. One thing that I learned through her is that I have to be an advocate for myself. You can't just accept what they tell you. Based upon how my tumor was growing and things were going, they gave me about 18 months. And she was like, no, I won't give you 18 months because nobody knows how this will progress. Nobody knows. So nobody can give you a time. And she said, if anybody gives you a time, then maybe you should question that doctor. So with this doctor, I was able to completely be honest with her, give her my concerns as being a young woman. And one of the concerns I had was this estrogen and taking these shots and all these extra things. I said, why not remove my ovaries? That's the main estrogen, that's where most of the estrogen comes from in our bodies as women. And so she was open to it. The MD Anderson said, absolutely not. That's too permanent. And she was like, if that is your body, you don't want any more children, why not? But she said, it is a permanent thing. However, I would never want to bring another child into this situation because it was hard enough to tell my oldest child that I have breast cancer and this cancer is going to kill me sooner or later. So we had the ovaries removed, which was a hard surgery for me. During that time, it was supposed to be a one night stay. I ended up being in the hospital for 14 days because my body got in such a shock that I was having seizures, at least 5 seizures a day. And it was really causing problems with that surgery because also fragile. I needed to heal, but all that jerking and stuff kind of, messed things up. And so, as I healed from that, I couldn't exercise. I couldn't do all the things that made me happy. And then all of a sudden, all my hormones are just kind of like stripped from me. So I went into not a depression. I went into a blah, meh. You know, there was no type of happiness. There was no sadness. It was just nothing. We put me on certain medications and things like that, like antidepressants and things to help me deal with this. Uh, Fast forward a couple of months, we did an X-ray. There was no evidence of the disease. Now, that does not mean that you don't have breast cancer anymore. What no evidence of disease means is that everything is small enough and you can't even see it. So it's you're in a safe zone. The longer you can stay that way, the better. So my doctor, I was on no cancer treatment, nothing, just completely eating healthier and things like that. And, things were looking good. As I said, things were looking good. I one night woke up in the worst pain of my life. It felt like I didn't know what the pain was, but it was down below. And I was like, what's going on? And I couldn't even walk. I was kind of like walking, wobbling, as if I was going into labor. Come to find out, my hysterectomy that they had to remove my ovaries had opened. And so my intestines were going through my upper vaginal area, which was weird. You can't see it. I couldn't see it. It was an inside. And so we had to have emergency surgery. So I had to get stitched up and things like that. So that kind of set me back a little bit. So that's how the journey went when it came to breast cancer. So currently, what we just keep me under maintenance. I started taking my tamoxifen again once I kind of got my leveling together. But the things that I changed within my life was how I ate, um, the water I drank, how much water I was intaking, exercise. Exercise has become the biggest thing, the best thing that has come to me. I've always been active, but this was like a being happy about going to the gym. It wasn't so much like, oh, gotta go to the gym. But me understanding that next week, next month, I may not be able to go to the gym next week, next month. Still to this day, I could be in hospice. Gave me a new leash on how I looked at life. Now, a lot of times people will break down, they go into depression, but honestly, it's about to be 3 years and October this month that I've been living with this metastatic breast cancer, but it's been the best years of my life. During this time, I started a nonprofit, which is called Travel with Pink Purpose. And Travel with Pink Purpose came about because prior to this metastatic disease, I always made an excuse of why I couldn't travel, why I couldn't go on vacation, and things like that because I was always working. I'm working. And so with that diagnosis, I said, let me go ahead and and change the way I look at things. Let's stop waiting for tomorrow because tomorrow may not come. So I started traveling, and I noticed that there's a lot of women who are suffering with the same thing, young women um, who are going through the same thing. So what I started to do was I became part of actual groups and things like that and support groups, which I didn't do the first time around because I felt like I didn't have a real cancer, so I didn't deserve to tell my story. And so as I, talk to these women and things like that, and these support groups are global. I noticed that the need for help and research was something that was a global issue, not just an Austin or a Houston issue. It was globally. So I decided that I was going to look at the top 25 countries that had the highest rates of breast cancer. And what was interesting is when I did my DNA testing, I looked at the areas where um, I'm from, and the areas that were on the side my Caucasian side, were all the areas that had the top um, places that had breast cancer. So I decided I was going to travel to all 25 of those countries and service women who are living with breast cancer. I've been able to go so far to 6 countries since this happened, but the pandemic has had me cancel, I think, 5 of my trips that I had planned for this year. Also, Travel with Pink Purpose is a way for me to go into schools. So I travel into schools and teach young girls who are in puberty to learn, to know their norm, understand what those lumps and bumps are on what are normal, what isn't normal, what you should be aware of, when's the right time to do the testing and things like that. Also, to most people now think of breast as a sexual thing, and it's anywhere from that. Of course, everybody wants to have these nice breasts and things like that, but it's more to your breast than just that. And so I wanted those girls to understand that you need to look at that as your lifeline. It says a lot, about you as a woman, but it says a lot about your health, keeping that, you know, keeping up with your checks and things like that. So, also during this time, I've started with the exercising, as I said, and sooner or later, I will be competing with in like bikini fitness and things like that. So I'm in the early stages of it. So I have quite a while before I do that. But what has helped me live with this metastatic disease is by positive thinking, having positive friends around, meditation, um, taking the time out to really enjoy life, enjoy my kids. Uh, work used to be one of my main focuses because, I'm young in my career. I wanted to be able to, my goal was to be, a director or a senior director over talent acquisition within human resource. So I just changed my focuses. I changed the things that where I started to love myself more. Also, accepting myself has been the biggest thing that I didn't have. Before I used to hide and didn't want anybody to understand what my journey was, what I was going through. But this gave me the strength as well as the courage to tell my story, not be embarrassed because I have scars, not be embarrassed because I'm living with this disease. Um, it's I would definitely say it's the best time of my life. Okay, how soon would you see him? Awesome. Okay, so one of the questions that is being asked, how soon would you recommend someone getting checked? So that's completely, I would say, based upon your family history. Knowing um, your risk is a big thing. A big thing. If you have a sister or aunt who has breast cancer, you need to start talking to your OBGYN in your 20s about getting your mammogram. And for Black women, it's probably there's a 3D mammograms and things like that. They're also great options because our breasts are a little bit different. The density is a little bit different, and so that's the best way to pick up on breast cancer. But the earlier the better. If insurance has questions, if you need to say that your mom had breast cancer, your sister had breast cancer, you need to do that. One thing that I do know that can be a problem sometimes now is in the African American community, we don't always know our complete risk factor. As I told you earlier on, I was an adopted child, so I don't know my paternal side. So it could be a huge thing with breast cancer. But there's also other types of checks that you can get, such as BRCA tests. Those tests tell you if you have a genetic mutation that will cause you to have either breast cancer, ovarian cancer, things like that. So get tested as soon as possible. If you have a history in your 20s, um, I would say by your 30s, you definitely should get a check. Um,
Can you say like what type of foods are you eating? You said that you changed, your diet and how you ate and things. So did you get rid of meat, dairy, like were there alternatives? Oh, okay. So can you just talk a little bit about that?
so one thing is that I I didn't eat much. I'm a person who I don't eat much. I eat a lot of sugars. So I can probably go all day as long as I can get a sweet in there. I do that. But what I've changed is that I eat more. I add more protein. I didn't give up meats. I'm not going to give up anything I love because guess what? I don't know how long I'm going to be here, so I don't even want to give up those things. But I've added more greens. I do smoothies in the morning now. I put that little scoop of that like the what do you call that? That organic green stuff, so I can get more vegetables because I hate vegetables. I do. Um, Alkaline waters are important. This is an inexpensive. Oh, let me see if I can see it. It's an inexpensive water. However, it's like having an Avion or things like that. Water that's bottled at the source is a very important thing. If you look at some of those things from Dr. Siebel and things like that, they'll tell you to drink those high alkaline waters. Has changed. I drink lots and lots and lots of water. It's helped my skin. All the medications that you're on a lot of times, and the depression medications that they give me, I need water, and so that's what I was not doing. I was not watering my body. But more importantly, when it comes down to my nutrition that I've changed is more so of adding those green vegetables that I hate so much. That's what I've changed the most.
So we have someone who put in the chat that says their sister has got breast cancer, but she's 28 years old, and they said the lump went from 4 centimeters to 2 centimeters. Then they want to know, is that a good sign?
Yes, definitely. My tumors shrunk as as you remove estrogen and things from my body, they shrunk. However, they can shrink, but they can grow legs and go somewhere else as well. So, but it's a great sign, especially if she doesn't have metastatic breast cancer. Now, that just tells her that whatever treatment she's doing or whatever she's doing with her body, is trying to fight it off. Or her medication is fighting off that disease.
We have another, someone says, I have a little ball under my armpit. Do I have to check that? Do I have to worry?
Yes, you definitely have to worry. That's not to be scary. That's what I had. I had a marble-sized growth under my armpit, which I didn't know you have to check your armpit so extensively. But yes, you definitely need to get that checked out. If you have a history, and the thing is, I'm not preaching dishonesty. That's not what I'm saying. But sometimes you have to advocate for yourself and do whatever it takes to save your life. And if it means that you may have to tell a little extra, then do what you have to do.
Another question came in. I have a hard time eating greens too. What do you like to mix your protein powder with? And is this plant-based protein? And is plant-based protein a good alternative?
I don't do a plant-based protein. I actually do a complete whey protein that has that's very filtered, is a good filtered one. But you got to realize certain vegetables like spinach, I would say the lighter kind of greens like that. Once you blend them in there, you don't really taste it as much. But that organic green, it's a they call it it's a little scoop of green stuff, and it has like 8 different vegetables in it. It tastes delicious. It has fruits in it as well, dehydrated, and you'll have a full day's worth of vegetables with it. So I would say, if your diet is, if you can do a plant-based diet, or that's the best thing for you. However, I'm just a picky eater. I'm like a 10-year-old. So that's the reason why I try to get some vegetables in there when I can. But that organic, I think green, there's a lot of different types of green scoops that you can put into your smoothies. You won't even taste them.
I have a question. So I was told that women should stay away from soy. Were you ever told that?
Well, so that's a misconception, just like the sugar thing. People think sugar feeds cancer. That's not true. So soy, you would have to consume so much soy, you couldn't, you couldn't, do that. Soy milk, all those soy things, they will not affect you at all. A lot of times they say that they act as estrogen, and the reason why people will say that about soy is because they say that it's kind of like a natural plant, like an estrogen that's in a plant. However, soy is still good for you. You can have it. You can never. I think you can never eat that much soy to where it would cause a breast cancer or anything like that.
So how often do you recommend women doing a physical check of their breast?
Every month. So the best time to do your self-exam is during the menstrual cycle. That's when your hormone levels are up there, and that's when you will more likely feel it. Now, a lot of times people are like, how do I know the difference between a mass and and just like my fibrocystic breast and things like that? Because that's one of the things that I'm like, oh, I feel something, and you will be able to feel it. It will feel like a hard mass. It's almost and it won't have any pain. You also would look for not just that lumps and bumps, but you also look for discharge in your nipples. You also look for cracked nipples. A lot of times, we're not sure if it's the detergent and things like that. But if you don't see a change, you put a little bit of coconut oil and you don't see any type of change or any type of oil, and it's still kind of cracked, that's a sign that something's not right. Or if it's red and hot, those are signs. But the mass usually, if it's it shouldn't hurt. It doesn't hurt those type of mass. When it hurts, sometimes not most likely, a lot of times it's not breast cancer.
Did you have any symptoms when you found out that you had cancer?
Um, no, none that I could ever notice. When I look back at things, I do realize that my fatigue. I was tired all the time, and I just thought that was just because I work all day. I take care of kids and things like that, but my energy levels were down.
I know you talked about fibrocystic breast. Me I'm 37, but at a young age, I would go for my Well Woman's Day with check, and they was like, "Oh, your breasts are real lumpy. You have fibrocystic breast.
Yeah.
It's very dense." And like, what would you suggest for women with dense breasts or fibrocystic breasts? Because every time I check, oh, it's a lump. What is it?
Right. Yeah. Yeah. Keep a close eye on that. One thing I would tell you to do is this is a good way to kind of, and this is just my own little thing. So if you ever have any marbles at your home, so get a big gob of Play-Doh. Put that marble in that plate, a big old gob of just Play-Doh, like just one little full thing of it. Put that marble in there and start feeling around. That's what an actual lump will feel like. It'll be that. It'll be that hard. I'm not talking about size wise. I'm just meaning as in hardness. You'll feel like that. Fibrocystic ones, you can. It's still soft. You know how your breast is still kind of soft. They feel lumpy, bumpy, but they're not. It's not hard.
Myself, just this topic is very, very touchy for me. But I have fibroadenoma. I have a fibroadenoma. Which is a mass in the breast. And so it's solid. It's nothing like a cyst. I've had those, but I have one and I get it checked at first it was every 6 months and now it's every year. And so, yeah, I would definitely suggest women, if you have those, and I advocate for it. They was like, "Oh, we can watch it." No, I want one every year. Every year.
And the thing is that, and that's what I was telling you. I'm not ever telling you to be dishonest with your doctor, but sometimes, like my doctor, and I'm not gonna say the name about that one, but she is willing to do what it takes to get insurance for the paper things. And like she said, so sometimes she'll ask you questions. She'll like, "So are you having any pains right there?" And I'm like, and she's like, "Are you having any pains right there?" I say, "Yes, I am having a lot of pain right there." So sometimes you have to have you have to know your doctor. You got to know that your doctor's best interest. Now, one thing that my doctor told me that I have now is that one thing about, how I kept asking the MD Anderson, "Are we going to ever check that breast again?" And based upon the laws of medicine, once you've had a complete mastectomy and removed all the breast tissue, they don't ever have to test that breast again unless something suspicious will happen. And they never gave me that part as if something suspicious had happened. So they just told me that they never would check it again. And I just kept saying, "Never?" And they said, "Well, it won't come back. The chances are very, very, slim." And every time they told me something was very rare, pop up.
So you're in that rare category.
Yeah, every time you turn around, it's very rare. And I'm like, okay. And so my now doctor said that she would have still had me get a test just because of the fact of my age. And she would have said there's a reason why I'm testing it. So you have to know that you got to advocate for yourself. You have to have people around you who will advocate for you, or just who have the wisdom of the right questions to ask. Because sometimes it's not about they're not giving you the information. It's that we don't know the questions to ask because we're not used to it. Maybe your age or your experience is the problem.
Can you talk about Pink with a Purpose?
Oh yeah, Travel with Pink Purpose. Um, as I said, it's about traveling to different countries, going to different schools, traveling, telling the story about Pink, and helping others out. So when I travel in these different countries, I've gone to so far. I went to New Zealand. I volunteer with their breast cancer foundation, which I found out a lot of cool things that different countries have that we don't. So my goal was to connect the world when it came to breast cancer research and things like that. You would think that this is a global thing. Why are we so siloed? Why are we not learning from this country or that country? In reality, every country is fighting to be the first one to get the cure versus everybody working together. And so I'm kind of like, going to these countries, finding out the different resources that they have and what they're doing and things like that, to help those women out as well as to help women out here, and also just kind of like giving different places that you can get more information. We have these Susan G. Coleman, we have all these things like that that are trying to get people to pay for research. However, different countries have different resources as well. And so I wanted to find those out, and I want to share the different things that we have.
Okay, great, great. When we think of breast cancer, and I can just think back as a teenager, or just even in my 20s. Oh, this is something that affects people who are 40 and over. Like, you don't have to start thinking about that till you like 40. But now we're seeing that it's happening at a younger age. Women are getting it at a younger age. And is it? And I don't know, but is it true that it's worse if you are diagnosed at a younger age, under 40?
That's an excellent question. So I'm gonna break it down as in there's two sides of how it's worse. It's worse because think about it. If you're diagnosed at 65 years old with breast cancer, your life expectancy is, 20 more years the most. When you're diagnosed at 26, you're like, so you're going to probably 30 to 40% chance that you're going to get another breast cancer. And so the younger you are, the more opportunities you have that breast cancer is going to come. It gives you more years of living to have. So 70 something years old, it's a difference. That's the main thing. Also, another thing is that a lot of times, age is one thing, but race is another thing that can cause it to be better or worse. As a young Black woman with the metastatic disease, your chances are low, not just because of the medical thing, but there are disparities within the healthcare field for women of color. And how you would look at it is that you don't have the same type of resources. Now I can look at myself 10 years ago when I was 26 and I was first diagnosed. Like I was saying, I was in graduate school. I was younger. I didn't have the same resources that I have available to me now that I've been in my career for quite some time. I have great insurance and things like that. So some of the disparities are with age would be that maybe you don't have as many people who understand it. Even your mom at 26, moms are still kind of young. Your mom may be like 46, 56, something like that. So they have never even experienced it. So age is more so not having the resources, the means, as well as you have more living to do, more chance of that breast cancer coming back.
Okay. We have a question in the chat that someone says, "Thank you for sharing your tips and experiences. I felt a lump that comes and goes on the side under my armpit and it moves around. I've been delaying a checkup because my friend says if it moves, it's benign. Did you notice the lump move or did it stay in place?"
So my like I was telling you, 2 months prior to me finding that lump, I didn't have a lump at all. But I did notice it moved around a little while right before I saw the doctor. So one day it could be kind of a little bit under my arm, a little bit deep, closer to the breast, and then sometimes it'll be further away. So they can move if they're cancers.
Okay. So yes, to that question, go get it checked out. I can tell you now, my doctors probably couldn't stand me in my 20s because I made them, you can't do a mammogram now. You can do an ultrasound. You can do one of those.
Yes.
Now, I wanted when I would go in, when I do go in for my ultrasounds or in my mammograms, to check my fibroadenoma, they would say, a lot of times a cancerous tumor, like you said, has oxygen, is living, and it's heat radiating off of it that they would be able to see on your exams, like as they're doing it, and they see your images, they could see the heat radiating off of it because it's breathing, it's living. And they would say, well, right now, we'll watch it, there's nothing going through it, there's no oxygen, there's not breathing. So yeah, get it checked out. Even if it's movable, and it comes and goes, still go get it checked out.
Yeah, and I have an example, just a personal example, not with myself. So now I do a lot of advocacy work, and my advocacy work is more based upon Black women living with breast cancer and the disparities that they have. In one of my groups, Living Beyond Breast Cancer, I'm a young advocator. And so what we do is we go into these conventions, we go to the scientists, we do all these things to lobby for, the same, type of treatment. So there was a young girl who went in, she's 26 years old, a lacrosse player. I forgot what school she went to. She's a young advocate as well. And so she kept going back and forth to this doctor and telling him something's wrong, this is not right. And they just kept sending her away, dismissing her, all to find out 2 years later she has metastatic breast cancer. So you have to keep going back sometimes, and sometimes you have to fire your doctor as well. If one doctor won't do what you need, or it's kind of like, oh well, we've checked it and that doesn't work, fire that doctor. You find your second, third opinion, because you don't want to get a second or third opinion once you have metastatic. You want to do it before you get a cancer.
So someone says they don't like vegetables either. Can you spell the name of that drink you said you, you
Let me,
drink?
yeah. I can put them in the chat, right? How do I do? I can. Let me see if I can.
Yes, you could actually answer it and click on that question. I know that you were probably looking at them as they were coming in, and you can type the name in there.
Okay. It's called organic green. Let's see. Let's see.
I can type it out if you give it to me.
Okay. Let's see. Make sure I'm saying green. Let me make. I'm looking on my thing. So, and you can easily get it on. It's called organic or goodness gracious, organic super greens. There's a lot of different types. There's lots of green powders that you can use, options. There's another one that I like a lot, organic greens. You can get it from Amazon, a tub of it. It's like, I think it was like $18. I'm trying to see if y'all can't see it. Okay, I was going to show you the
I just
picture
put
of
it
it.
in. I put it in the chat form.
Okay, it's called organic greens, and it's $14.98, and it's lots of servings. Now, if you don't like sweets much, you may not like it because it's very sweet. Um, I like to put it, I add it with my protein powder, I add it in almond milk and stuff, and I go about my business. But it's delicious. It is. But I like sugar a lot.
So I think that was probably the last question. But Ms. Reese, I want to thank you so much for just sharing your journey and just being transparent with us, because a lot of times, you get guest speakers and it's not very transparent. But for you to actually go into your journey, personally with us, we just truly appreciate it. And like, a lot of us are young. We have
Right.
younger students who are scared to ask us questions like, oh, well, I'm not that old, so I shouldn't get it checked out. It's okay. But for you to come and talk about your journey, saying that it started at the age of 26, where many of our students are in that age, 24, 25,
Right.
26, you just gave them that little bit of to say, hey, I'm going to go ahead and
Please.
get that checked out. So we truly thank you for your wisdom, your expertise, your sunshine outlook on life. We do thank you so much, and we truly appreciate it. We would love to keep you in our Rolodex of people we can pull from,
Yeah.
as in just encouraging women empowerment. We would love to have you back with us.
And one other thing I want you guys to know, give out. I have no problem. Give out my cell phone number. It doesn't matter. If anybody just wants to talk or have any questions that maybe they want to ask offline. I do this all day, almost in between work. I'm in all these different advocacy groups and things like that, because there are a lot of questions that are not answered. But my main takeaway from here is advocate for yourself early. Understand your body, understand what's normal to you, understand all those things that you may not, you're embarrassed and this and that. Be honest with your doctors. You got to be honest. That's one thing. Get yourself checked out. And if you don't, get a friend, because guess what? This sounds funny, I go with strangers all the time to get mammograms. So, or ultrasounds, because the thing is, I want to live my last days helping others out. So You can give out I'll put my cell phone number anywhere, and feel free to reach out to me. Or if you have a family member or a friend who needs to talk to somebody, I don't have the answer to everything because I'm not a healthcare professional, but I have so many, anywhere from a nurse practitioner, doctors, even surgeons in my database of people who are just my friends that I talk to daily.
Thank you so much. And guys, like if you need that information, reach out to me. I can give it to you. Just send me an email. I'm Ashley Rhodes. If anybody in the presentation don't know, I'm the student life coordinator for Northeast. So reach out to me if you would like to get Mrs. Reese information, and I'll pass it on to you. But again, thank you so much for this. We appreciate it.
Thank you, guys.
Wishing you life and love and happiness and everything. So thank you, HGC Eagles, for joining us. We thank you for
so much.
your afternoon, for being with us and being informed. So you guys have a great day.
All right. Enjoy your day, guys.
Thank you. Bye-bye.